of public benefits that are available to people with limited means. These products and services are paid for by the city, by the county, by the state, by the federal even. So it's all taxpayers' money that we all can avail if needed. And oftentimes, masajid, by the grace of Allah, have resources in zakat, in fitrah, in sadaqah, and so on to support the community. But that's good. That should continue. But again, at the same time, there are many resources that are available through public sector that's available for the community, some to everyone, right? And so we thought it would be interesting, at least helpful information that we can share with you. And coincidentally, I work with this agency now that offers these services free to the community members at large. So I work for this organization called South Asian Network, which is a secular, there are some Muslim members also and then non-Muslim members also working there. But they provide services to anybody and everybody who needs in the community in Southern California, no questions asked. It's a 30-year-old organization, pretty old. And I am privileged to serve as the executive director there for the last couple of years. So inshallah, I'll share a few slides about that and then the actual program. So there are 4 areas that the agency I work for does. First is supporting our sisters, women in the community, again, Muslim, non-Muslim, Christian, Hindu, Sikh, from South Asia primarily, but also from other areas. Those who need assistance in case management, in legal services, who are the victims and survivors of domestic violence and other types of social problems. And then the second program is to provide the emotional and mental health therapy to individuals, to families, to couples, to groups like this also. And the third is to support folks with citizenship and immigration matters. So people who are eligible to become citizen but don't know how to fill in the form, because to apply for citizenship, it's like a 15-page form, requires about $1,000 to pay and so on. We all do that for free. Free filling the application and then providing fee waivers, providing language assistance, interview assist, all kinds of stuff. The last is the community health action, to provide help to the community members so that healthcare needs are fully met. And that's the program I'm going to talk about today, not the other 3. I just mentioned that because to just give you an idea as to what the organization is all about. The organization that I serve for, it is largely focused to serve the South Asian community, namely from people from India, Pakistan, Bangladesh, Sri Lanka, Burma, Nepal, Afghanistan, these areas. There are similar agencies like for Koreans, for Chinese, for Vietnamese, for Filipinos, other Asian communities also. And the expertise we have is basically language, language and culture. And the way these agencies operate is Uncle Sam gives money to the state, state gives the money to the county, county gives the money to the city, city gives money to these organizations like us. So it kind of filters down. And there are specialty groups for different communities. So Access, for example, does for mostly Arab and North African countries. They get funding to support that community. There are some differences between these organizations, but by and large this. The other important part is cultural competency. So let's say, for example, I have an emotional problem, I have a mental health issue, something, I go to a white therapist who is non-Muslim, who may not understand my cultural dynamics or my cultural specifics, as opposed to if I go to a Muslim male, a practicing Muslim therapist, he would understand my challenges, right? So cultural competency also makes a big difference. So we have staff who are Muslims, who are professionals, who are licensed, who are trained to provide these services and assistance to the community members with that specific cultural competency also. And languages, right? So language is also an issue. If I don't, I'm not able to speak English properly, then I don't know how to avail the service, how to fill in the form. And language barriers is a major issue to access services from the county. So that's the expertise of the organization I serve. So now, what are public benefits? As Brother Jawdat briefly introduced in the opening, that it is about healthcare primarily, and then there are some social services also. So Medicare, Medi-Cal. Some of us who don't make enough income, we are also qualified for food stamps. We distributed just ending on June 30th. I should have shared this with the community before. It was a short period that county gave almost $1 million worth of coupons, grocery coupons, $900 per month, or $900 for a year, that you can spend in a grocery shop to buy any fresh produce. This is the county, Los Angeles County gave, and that program continues to happen. A lot of money and a lot of resources out. WIC, the woman, infant, and for children and women. SSI and CAPI is, I believe, cash assistance program. So in some cases where folks are below federal poverty level, then there's actually cash support to the families and to the community members. And then patient navigation. Sometimes in our community members, they need help to just set up an appointment, or call the public transportation to come and pick you up and then take you to the hospital, bring you back home. Some people can do that. So if that person coordinates with my agency, my staff will call them on their behalf and organize the doctor appointment, the transportation, taking back and forth, and all of that. And of course, education workshops also for diabetes, for cancer prevention, and other advocacy like healthcare reform and so on. And then lastly, the mental health and case management. So these are the broad umbrella of public benefits. Under each item, there are different things that we will go through, inshallah. Health insurance. So, tawakkal Allah wa kafa billahi wakila indeed is important, but tying the camel, having some type of insurance, and then making dua that, Ya Allah, give me good health, is an obligation really for all of us, right? So healthcare, health insurance is just important and good for all of us, and now it's also required by law, right? Since the Obama administration, they mandated the having insurance, mandatory insurance for all of us. So we are a enrolled agent with the state of California and Department of Health and Human Services to enroll folks in covered California and a variety of other medical health plans. In many cases for free, in some cases some small fee that's required. So let's look at this, and I don't know if you can read this. Can you all? This is the chart of the federal poverty level. I don't know if I can expand. I got a PowerPoint, yeah.
No, this one.
Oops, sorry. There we go. So that's expanded. Jazakallah khair. So that's the chart for the federal poverty level. So on the left hand side that you see the numbers 1, 2, 3, 4 downward, that's the number of people in a household. So if I am a single man and my income is $13,590 in a year, that means I am automatically qualified for all types of insurance basically. And if you go down the numbers, if I'm a family of 4 and if I'm making $27,750, I am qualified for everything basically, no questions asked. And it goes down all the way to 8, 9, 10, whatever. That's the first column is the 100%. And then the second column is slightly more. So if I'm making more than $13,590 and making $18,000, 138% of the federal poverty level, I am still qualified for the federal health care, but I have to pay maybe a tiny bit from my pocket, you see. So those are the first two columns that are completely under Medicare, 100% free for people who are making that much income. Moving on this side, then the numbers increase. For these, they are for mostly covered California. So if you are a single person and you're making 27,000, for example, right, double the amount of the federal poverty level, then you are still qualified for covered California, and there may be some small amount that you have to pay. So that basically is the chart by which we go. So I go to this agency and I say, you know what, I'm making 15,000 and I have two family members. They will run through this chart and say, you are qualified for A, B, C, D provisions. Fill in the form, I'll fill in the application, submit it to them, and then you will get all of these applications. So this is the basic reference chart for us to look at. So let me go all the way here. If you notice this number, I wish I can make this money, but 148,000, 167, 186,000 for a family of, I don't know, 8. So if I'm making $186,520 and my family is 8, well, this is maybe an anomaly. Not many people have family of 8. Let's say family of 4 or 6, how about that? Which is very probable, right? So if I take family of 4 and I'm making $111,000, I'm still qualified for benefits. I did not know this, frankly, before I started working for this organization. So it's amazing how many resources are available for the community, but we just don't know how to avail them. Any questions on this? Okay, I mean, you may have some questions on the road, but this is and you can look up, you can Google, federal poverty level and give the year, it gives you the chart, and you can see where you fit in. If you see that you are fitting in one of the columns, then you can avail those services essentially. You don't know how to do it, call us. And I have the lady's phone number, the business card, you keep it with you or give it to people who needs this and they'll call and they'll organize that. So this is for undocumented people who don't have green card, who are not citizens, no documentation whatsoever. Even they are qualified, or they are eligible, not qualified, they are eligible for various benefits. So people who are low income earners, again referring to the federal poverty chart that we just saw, people who are under 26 years old or over 50 years old, they are eligible for Medi-Cal, right? So there are some people in our community who are not documented, who overstayed their visa and they don't have any documents. They can still, then poor guys, they may be paying a lot of money to buy insurance or no insurance, which is also not good. God forbid if something were to happen, then they would not have the ability. And then what happens when they come to the masjid and say, I don't have this, can you help me out? Of course masjid helps. But you are saving on one side the resources which can be used for people who really, really need it, while the people who are in this category, they can still avail public benefits, you see. And the second group is for people who are 27 to 49. So the first group is less than 26 and more than 50 years old. The second group is more than 27 and less than 49. They are also available, right? And there is a URL link there, californiahealthcoverage.org. They can go there and apply. No questions asked. Sometimes our people are afraid that if I go as an undocumented person and apply, they may deport me, they may report me to ICE, etc., etc. No, they can't. Legally, they cannot. And if you don't want to do that, that's fine. Don't go there. Call us. We'll help you. Now, these folks have to be in LA County based. So, people who live in Hawthorne, Lawndale, Torrance, or anywhere in the LA County. These programs are good for LA County only. So what do we need? We need proof of identity. So your passport, for example, from the country of origin, and LA County residency. So, bill or a car registration or something like that, that should do, and proof of income or lack thereof. Those are the credentials that you need to be able to apply. And coincidentally, I researched before coming here. For in Hawthorne, there's a clinic right here on 117th, literally three streets away from here, for this area, that you can walk in and avail these services. So this is for the undocumented folks. These are for, yeah, so this is for senior people, our elders, those who are 65 years and above. If you are 65 years old and you are a citizen or a green card holder, you may be eligible for free medical health insurance, of course, depending again on your income. Many of our community members who are 65, 70, I'm at the borderline, but the Jawad, I'm 62 now, so I'm 3 years away. Many of us are in that range, you know, so especially at that age, our medical needs increase. You have back pain, you have knee problem, you have this, that, you know, the machinery slows down and wears down. So it's important to have, you know, health coverage, especially at that age. Folks who are 65 and above, they are available, right? And if you are 65 years old, you are eligible for Medicare. So Medicare has lots of tiers. So my colleague asked me to share these three ones which are most important: Part A, Part B, Part D. So Part A is related to hospitalization. If I am hospitalized, then who covers that expense? Medicare will cover that expense. And Part B is going to the doctor visit and your eyeglasses and anything related to vision, and the third is dental. So all of that is covered in Part B, and the Part D is prescription, you know, medication that doctors will write to you. So either way, people, our elders in the community, they are covered one way or the other, partially or fully, based on their income level through Medicare program. The other resources, other things that seniors can also avail is those who are 65 years or old and who have earned enough credits during the course of their working life from age, I think 18 or 19 all the way to 65. When you accrue those credits, you are automatically eligible to apply for SSI and the other three Medicare Part A, B, and D. But if you're 65 but did not work in the US, you came at the age of 52 here, for example, and you worked only 10 years, 12 years, 13 years to reach age 65, you can still apply for supplemental income, especially if you are low income. And when in that case, you are eligible for Part B, and Part B is about, you know, regular doctor checkup, visit, and dental and vision and so on and so forth. So either way, if you have earned enough credits or if you have earned less credits, either way you are qualified for these benefits, and that's available to you. This is for senior people, our elders. And this is for CalFresh, right? Food stamps. People who have lived in a country for 5 years or more, right? So that's one qualification for being eligible. They can avail the food stamps. And people who already have applied for and have received disability benefits, they are automatically enrolled into the food stamps program. And children under 18 years of age, right? Because they are not working anyways, so they are automatically qualified. Non-citizens, those who are asylees, refugees, you know, people from various trouble areas, you know, Syria, Iraq, Afghanistan, Burma, and other places, who come here on asylum visa or refugee visa, they are fully qualified to receive food stamps as well. And here's the chart, and let me see if I can blow this up also. Same thing here, number of people in the household and gross monthly income. So if I am family of 4 and I am bringing home $3,976, not net, gross, then I'm qualified to receive food stamps. And goes on. However, number of family members, and the first column is gross income and the second column is net income. So if I am 1988 in my net and 3976 in my gross, in which case this is the maximum amount Uncle Sam gives for, again, number of people in the household and the maximum amount you will get in the food stamp. So a family of 4 gets $649 per month. That's like $14,000 or $15,000 per year for food expenses, you see. So that's for CalFresh for people who need. And then you have CalWorks. So some of the people who come from overseas, they come here, they don't have the language skills. They are smart people, they have done good work in there, but they don't have language skills. And they don't know how the system works here. So CalWorks allows us to, provide, especially for younger folks, right? For kids, short-term cash assistance, and limited for people who are limited resources, hardly, again, in under poverty level stuff. And GR is the general relief. So people who really don't have any source of income, indigent basically, and who are ineligible for federal or state programs, they can apply for the general relief resources. And they also have offices in these Rancho or LA. But keep in mind that all of these programs, it's complicated. If I were to go to any of this county office, just to find the right person is a headache. It takes time and it takes energy, and sometimes they don't have the right person or the right information, and send you from here to there to frustrate you. And you can avoid all of that to avail non-profit orgs like us who provide these services at no cost to the community members. And then lastly is the WIC, Women, Infants and Children, supplemental resources essentially, and not only food and cash, but also healthcare referrals. So complex cases for sisters who are pregnant or who just gave birth and then don't have the energy to do anything else, and they need some specialty assistance, medical assistance, so the referral services, nutritional education available to pregnant women, and especially those with children 0 to 5 years old, so babies. Again, there is an office on same 117th Street, not too far from here. And the WIC is available to people, again, household size and the annual income and the monthly income. Similar arrangement basically. So these are the services or public benefits that are available through county and state. And our really objective was simply to provide this information, and either those of us who are eligible for this, or those who we know. We may not be eligible for this maybe in some case, but other people are, our neighbors, our friends, and the community members. Well, I mean, we should avail this, because after all, this is taxpayer money, and that's out there, that's available. So we have 2 offices. One is in Artesia, other is in Little Bangladesh in Koreatown. And all of our services are free, Monday to Friday, 9 to 6 p.m. People can call and ask for this sister Nina who does this work, and she'll be happy to help. And if for some reason you can't reach her or anything, call me, and I'll be happy to figure out a way to assist you, inshallah. I'm not an expert in this, my staff is, and they know much more than I do. So I'll stop there. If there are any particular questions, I'll be happy to answer. And there are some information here about these programs. And if any of you wants my staff to call you, or my staff to call somebody you know, you can leave your information here and I'll make sure that she calls and help the family or the individuals. Hope this was helpful. Yes, no, maybe. All right. Are there any questions, comments? Yes, please.
Yes, I have a brother who needs all this help, but they don't have any ID. For some reason, all this ID they don't have it. No, working, paying for the table. They don't have any ID.
ID. Yeah. So they live somewhere, they live with somebody maybe?
He's an animal. So he gets jobs, some he pays bills sometimes, but he's not qualified for any of these because of all his IDs.
No ID at all. Credit card?
No.
No.
You used to have advertising.
Yeah.
Because you don't have ID went to the unit, and they always they call it immigration.
He's qualified though for making an ID, so maybe the brother does not know, or he's afraid to go to DMV to, right? He's afraid to go to DMV, yeah. So there is a brother in the community here, I don't remember his name, but I know him by face. He works for DMV, right here. He helped me, frankly, at one time. I didn't want to stand in line, and I saw him. I said, "Brother, Assalamu alaikum." He came, he took me and asked the manager to wave. He's a Pakistani brother. He comes to this masjid for Jummah Salat. MashaAllah, beautiful beard. But DMV makes the ID in the state of California. Anybody who lives here, they may not be qualified to work, but they can still make an ID, California ID. He should do that first. That will be helpful because that will open doors for many things, right? But I take a card, have him call anyways, and let's see if my staff can do anything for him. Inshallah.
These bands have that phone number on them.
Yeah.
I'll show them to give it away.
Yeah, both. Yes. These are such just to give away these notebooks and this and that. Yeah.
Give them out.
Yeah, please. Yeah, that's what I brought this for. You know, all of this
They're all
list of benefits that people can receive. So have him call, brother. Have him call my staff. Here's a business card that brother Majid is going to give you, and inshallah we'll see if we can help him out. Yes, please.
So the undocumented, the Medicare for undocumented, does that also cover people who are visiting?
On a valid visa?
Yeah, on a visit visa.
On a visit visa. I believe so.
People who are visiting can also apply for Medicare.
I believe so. Don't take my word, but again, give a call to my office, you know. Yeah, if undocumented people can get, how about documented people who are basically have a valid visa to stay in the country for X period of time, 6 months, a year, or whatever. Oh, I see. Okay. Sure. You have the business card there? Did you get the card? Here. Take this, if you don't mind. Her name is Nina Sharmeen. Call tomorrow. Yeah. Yeah, I believe so, but just confirm. Inshallah. Uh-huh. Right.
family insurance. She is also part of that.
Okay.
Do I need both or should I just
I would say yes. You know why? Because sometimes on your employer granted insurance, if your deductible, let's say, is $1,000, and this gives you 100% coverage, you can avail this. And there may be sometimes that this doesn't cover, but that covers. So you have multiple to as a double insurance basically, because the person is special needs, right? So I would definitely take anyway. There is no harm. There is no harm. And the person who is taking care of her, whether she is your wife or mother or somebody else, they are also qualified for home care services. Yeah, yeah. I mean, many people don't know. Like in many cases, let's say, for example, I have a 90-year-old father, I'm taking care of him because it's my duty and I'll do that anyways, right? But the system also grants me financial support to take care of my father who is homebound and so on. So that's another service that's available to us.
do you also have anybody who can help us find a respite worker?
I mean, in our agency, we don't have services, but we will have partner agencies. We have partner agencies who are bigger than our agency. So we can provide referral service essentially. So we will refer you to somebody else who may have that service. Yeah. Wayyakum, wayyakum. Jazakallah khair. Pens are free. Yeah, and there is a phone number on the pen also. So just and the URL and stuff. Yeah, it's easy to remember and call. Yeah, this is the complete brochure of all the services that we provide. Yeah, if you want, grab it. Yeah. Yes, please.
Yeah, my wife never worked. She have a problem with the back. So she can qualify for disability.
Did she? But she's a citizen, legal.
She's 50 years old.
Yeah. So.
I'm working too, so.
Yeah. So she has to first get certification from doctor or hospital or somewhere that she's not able to work, that because of her back injury that she cannot work. Once you have that, then you can apply for this. You understand?
If I'm working too, it doesn't matter.
Depending on your income. So if you're making $200,000, maybe not. But if you're earning less than 100,000 or whatever, and you have kids to take care and so on, then you may be she may be partially qualified for. The other thing is, if you do joint taxes, right? If you do joint taxes, then yes, your income will come into play. If you are not doing joint taxes, then she's independent and you are independent, and she'll get 100% in that case. Yeah.
She can qualify some part of her disability or
Correct.
the income of 140.
I don't know the income level for this purpose, but you have kids also with you, or? Yeah. If you talk to Nina, my staff, she'll be able to determine how much and what are the steps. I think the step one definitely is to get medical certification that she cannot do any physical work. And based on that, then they will determine how much and so on. All right, inshallah. If there are no questions, that's fine. We don't have to force you to. Yes. Pardon me? Arabic speaker in the office? Unfortunately not. To some extent I can help you maybe if you call or explain to me now, and then I will confirm with my staff, and then if you have a specific question, I will get you. General question. Okay. Can you ask that question now, or? Oh, I see. Arabic. Yeah, no, unfortunately not. We don't. We don't. Yeah, like I mentioned, our agency is mostly for the South Asian folks. And if you call Access California in Anaheim, they have Arabic speaking folks and they can help you. They do the same thing. Most of the things are similar, some are different, but they'll be happy to help you. And let me see if I have their phone number so you can have it right here now. Access. Oh, I don't have Wi-Fi here. Yeah, I'm sorry. But I'll give you the number on my phone maybe. Any other questions or? Okay, my brother, here's the number. You have a pen? 714 Sabamiya Arbatash. I'll try my Arabic now on you. Tisamiya or 17 is Khamastas, Sittas, Sabatash. Tisamiya or Sabatash. Sifar, Arba, Sifar. How about that? Broken Arabic, shoya. Mazboot? Excellent. Excellent. Yeah, so you can call them and they have Arabic speaking staff members, so they'll be happy to help you also. Correct. In Anaheim. All right, inshallah, I don't want to hold you hostage. If But Jazakumullah khairan, take care of yourselves. I mean, it's important that health is an amana, of course, we all know, and anything and everything that we can do to take care of ourselves, inshallah, is going to be rewarded to us and our families, bismillah ta'ala. Jazakumullah khairan, mashkureen wa mujammal for your time and attention. Assalamu alaikum wa rahmatullahi wa barakatuh.
postgraduate will be just the visa stamp, not for the medical level. So, तो ये लोग कहते हैं कि प्रूफ करना होता है कि जैसे asylum वाले तो जहाँ जिस मुल्क में आप रह रहे हैं वहाँ या it was here, Sula said, उस सूरत में और अगर वो सूरत हाल ना हो तो फिर शायद ना लोग सीरिया में या वापस आऊँगा तो वहाँ उस सूरत में वो लोग कहते हैं नॉर्मल हालात होम कंट्री आपको भी इंडिया में कोई नॉर्मल तो है नहीं मैं पूछूंगा वैसे और अगर कोई ऐसी गुंजाइश हो जो कोई रास्ता हो तो मैं आपको कॉल मेरा नंबर इसी पे है और इसका नंबर यही है मेरा नाम शकील है मैं आपको मेरा एक्सटेंशन है मैं हैदराबाद अच्छा दिल्ली में पैदा मैं बात करता हूँ और साथियों से तो इंशाल्लाह आपको मैं उससे कॉल करूँगा या उनका कार्ड आपको मेरा नाम मीना है वो बड़ी एक्सपर्ट है तो मैं उनको कहता हूँ या खुद मैं आपको कॉल बढ़िया गाँव में आदत से ज़्यादा Assalamu alaikum wa rahmatullahi Oh, yeah, I think I have to run that day or something. Unfortunately, yeah. You know, to leave these things here, you know, people can use it. They are open. Then, most importantly is this. Anything that real estate can actually create real estate. Different, two different. One is all of the program, and the other one is specific about the benefits. Yeah, you never know. It's not something. Yeah. Most people are either. I did not know. Honestly, I never. I didn't think you're still qualified for South California with Council Savings. It's something. Good for you. I'm sorry. we assume exactly. If you don't apply, if the chance that you apply, maybe you will get it, but it's a fine.
The intimidation factor there for the application is so cumbersome and so confusing. I must be really let this message. It's difficult to read.
It's that's my text.
Yeah, exactly like that. So,
But if you're doing it, but the text is fucking.
yeah,
But it takes time. It takes hours and hours. But you understand the law.
yeah.
You have to protect that.
Yeah, typical county and state
Mistake. So, October,
yeah,
what's the lucky year? want to talk to me? Can I explore with you? I love a lot of you. Have a look.
الله أكبر الله أكبر الله أكبر الله أكبر أشهد أن لا إله إلا الله أشهد أن لا إله إلا الله أشهد أن محمدًا رسول الله أشهد أن محمدًا رسول الله حي على الصلاة حي على الصلاة حي على الفلاح حي على الفلاح الله أكبر الله أكبر لا إله إلا الله الله أكبر الله أكبر. أشهد أن لا إله إلا الله، أشهد أن محمد رسول الله. حي على الصلاة، حي على الفلاح، قد قامت الصلاة، قد قامت الصلاة. الله أكبر الله أكبر، لا إله إلا الله.
استووا للصلاة يرحمكم الله. استووا أثابنا وإياكم الله. الله أكبر. الحمد لله رب العالمين الرحمن الرحيم مالك يوم الدين. إياك نعبد وإياك نستعين. اهدنا الصراط المستقيم، صراط الذين أنعمت عليهم غير المغضوب عليهم ولا الضالين. إذا الشمس كورت، وإذا النجوم انكدرت، وإذا الجبال سيرت، وإذا العشار عطلت، وإذا الوحوش حشرت، وإذا البحار سجرت، وإذا النفوس زوجت، وإذا الموءودة سئلت بأي ذنب قتلت، وإذا الصحف نشرت، وإذا السماء كشطت، وإذا الجحيم سعرت، وإذا الجنة أزلفت. علمت نفس ما أحضرت. فلا أقسم بالخنس، الجوار الكنس، والليل إذا عسعس، والصبح إذا تنفس. إنه لقول رسول كريم ذي قوة عند ذي العرش مكين، مطاع ثم أمين. وما صاحبكم بمجنون، ولقد رآه بالأفق المبين. وما هو على الغيب بضنين، وما هو بقول شيطان رجيم. فأين تذهبون؟ إن هو إلا ذكر للعالمين. لمن شاء منكم أن يستقيم. وما تشاءون إلا أن يشاء الله رب العالمين. الله أكبر. سبحان الله. سمع الله لمن حمده. الله أكبر. الله أكبر. الله أكبر. الله أكبر. الحمد لله رب العالمين الرحمن الرحيم مالك يوم الدين. إياك نعبد وإياك نستعين. اهدنا الصراط المستقيم، صراط الذين أنعمت عليهم غير المغضوب عليهم ولا الضالين. والليل إذا يغشى والنهار إذا تجلى وما خلق الذكر والأنثى إن سعيكم لشتى فأما من أعطى واتقى وصدق بالحسنى فسنيسره لليسرى وأما من بخل واستغنى وكذب بالحسنى فسنيسره للعسرى وما يغني عنه ماله إذا تردى إن علينا للهدى وإن لنا للآخرة والأولى فأنذرتكم نارا تلظى لا يصلاها إلا الأشقى الذي كذب وتولى وسيجنبها الأتقى الذي يؤتي ماله يتزكى وما لأحد عنده من نعمة تجزى إلا ابتغاء وجه ربه الأعلى ولسوف يرضى. الله أكبر. سمع الله لمن حمده. الله أكبر. الله أكبر. الله أكبر. الله أكبر. السلام الله أكبر. الله أكبر. سمع الله لمن حمده. الله أكبر. الله أكبر. الله أكبر. الله أكبر. الحمد لله. مالك الله أكبر. سمع الله لمن حمده. الله أكبر. الله أكبر. الله أكبر. الله أكبر. السلام عليكم. أشهد أن لا إله إلا الله. اللهم صل على محمد وعلى آله كما تعالى. اللهم صل على محمد. السلام عليكم ورحمة الله. السلام عليكم ورحمة الله. استغفر الله. استغفر. Jazakallah khair, Brother Shakil Sayyid, for coming all the way from Corona to do the workshop about the public benefits. He works with the South Asian Network, and we have few pamphlets and brochures. It helps a lot. It helps those who are looking to apply for medical, if you're looking to apply for Medicare, CalFirst, senior services, a lot of services, even immigration services. So they help a lot. And the flyers are out there.